Heel pain, which is also known as plantar fasciitis, is an inflammation of the plantar fascia, which is located on the bottom of the foot. Typically, patients present with pain after the first steps in the morning and also after extended periods of rest. Patients also describe pain with continuous walking or standing throughout the day. We typically treat it conservatively, starting with anti-inflammatory medication, strapping, icing the foot, teaching patients the RICE method, which is rest, ice, compression, and elevation, and sometimes also injections. We typically try to prescribe custom-made orthotics for patients to help correct any foot abnormality they may have, such as a low or high arch.